C. Classes of health insurance coverage. Health insurance is generic term encompassing several types of insurance contract which, though related, are designed to protect against different risks. There are two separate types of insurance included in the generic term health insurance. One type provides coverage for expenses related to health care, and the second is designed to provide payment for loss of income. The terminology used to reference health insurance varies from state to state, as well as from company to company. The health insurance policy that is designed to provide periodic payments when an insured is unable to work because of sickness or injury is referred to as disability income insurance. C1. Individual and group. Most health insurance is written on a group basis from one employer. Individual coverage may be available for a family, but it would be medically underwriting. Individual health insurance policy are underwritten to cover the applicant, their spouse, and family. Many of the factors considered in life insurance underwriting apply. However, unlike the life insurance where there can be only one death claim per issued, in health insurance, multiple claims per insured is the rule rather than the exception. For this reason, underwriting and classification of risk is extremely important from an insurance company standpoint. There are the three most important underwriting factors considered in accepting or classifying health insurance applicants are as follows. Physical conditions of the applicant and other insureds, moral and moral hazards, and occupation. From a consumer standpoint, as important as the coverage period, provided the right to continue the policy is extremely important, particularly if he or she has become uninsurable. While near all states have adopted the NAIC model law for uniform mandatory provisions, there are still more variables in individual health insurance policies other than types of policies. Group health insurance underwriting varies in important particulars from that of individual health insurance, while the purpose remains the same: evaluation of the inherent hazard and assignment of the appointment class and premium rate. The techniques and standards for evaluation are decidedly different. The group underwriter has the reasonable not only to deciding whether and on what basis the group may be insured, but also the drawing the contract in such a way as to prevent adverse selection against the insurer by individuals eligible for coverage. Few applications for group health insurance are rejected if the applicant complies with any applicable statutory definition of a group eligible for this type of coverage. In part, this is because the underwriter may adjust the coverage and requirements necessary to afford protection to the insured. The underwriter's attitude toward group risk can be less restrictive than with individual policies, because the group policies are subject to annual re-evaluation on the anniversary date. Remedial measures may be taken if the initial evaluation proved to be incorrect. C2. Private versus government. Private insurance companies provide the large portion of all individual and group health insurance. The federal government, however, provides coverage for some disabled individuals and those over age 65 in the form of Medicare and Medicaid. Medicaid offers assistance as both a federal and state-sponsored program. The federal government also offers disability insurance protection through the Social Security system. C3. Limited versus comprehensive. Limited health insurance policy only covers specific accident or disease. A comprehensive plan would cover all sickness or accidents that are not specifically excluded. D. Limited policies. D1. Limited benefits and amounts. There are a variety of health insurance policies providing limited coverage for specific accidents or sickness. These contracts must be specify the type of accident or sickness covered. Limited perils and amount of coverage. Benefits may be paid on a expense paid basis or indemnity basis. D2. Requirement notice to insured. To make sure that the insured is aware that the policy benefits are limited, the insurance company must, by law, plainly state the limited policy notice on the first page of the policy. This is a limited policy. The 3 types of limited policies. Accident only. Accident only policy are limited policies that provide coverage for death, dismemberment, disability, or hospital and medical care resulting from an accident. Because it is limited medical expenses policy, it will only pay for losses resulting from the accidents and not the sickness. Specified disease or dread disease. A dread disease or limited risk policy provides a variety of benefits for specific disease such as cancer policy or heart disease policy. Benefits are yearly paid as a scheduled fixed dollar amount of indemnity for specified events or medical procedure such as hospital confinement or chemotherapy. Hospital indemnity income. A hospital indemnity policy provides a specific amount on a daily, weekly, or monthly basis while the insured is confined to a hospital. Payment under this type of policy is unrelated to the medical expenses incurred, but based on the numbers of days confined in hospital. This can be called a hospital fixed rate policy. Dental insurance. Yearly dental insurance distinguishes among several classes of dental expenses and provides somehow different treatment for each. Routine and preventive maintenance is covered up to an annual maximum without a deductible or co-payment. This coverage benefit yearly includes routine examination and teeth cleaning once a year and perhaps full-mouth X-ray once every 3 years. This absence of a deductible and copayment is intended to encourage preventive maintenance, routine and major restorative care. Routine and major restorative care includes such as treatment of cavities, oral surgery, bridges, and dentures. These produces are covered up to a specific maximum, subjected to an annual deductible per insured per family member and a co-insurance. Orthodontic care, if included, will have a specific maximum and separated deductible, which may differ from the deductible for restorative care. Scheduled benefits. Basic or scheduled plans pay benefits from a list of procedures up to the amount shown in the schedule. Most plans provide first dollar benefits without co-insurance or deductible. Maximum benefits are often lower than the usual and customary charges of dentists who force the insured to bear a portion of the cost. Vision care. Some employers provide this form of group health insurance to their employees to cover eye examination and eyeglasses or hearing aids on a limited basis. Know that per Affordable Care Act, predictive vision benefits are mandatory.